So today I will be explaining how to change wound dressings. So the first step, you should know that the nurse should be wearing all the PPE, and second of all, I will be presenting to you the materials needed. So the first thing you will need is a plastic bag for medical waste, so you can dispose everything that you will use during the procedure in this bag. Second of all, you should have sterile gauze so you can do the new dressings. You should have bandages so you can secure the new dressings. You should have bandages. That part is not obligatory, but if necessary, you may wrap around the patient's leg or the dressing to secure it. You will need a cotton ball so you can dump into cleansing solution to clean the wound. You should have a pair of medical tweezers so you can hold the cotton and clean the wound. You should have a pair of scissors so if needed for you to cut the bandages or the other type of bandages. And you will need a new pair of gloves, and actually you might need more than one depending on the case of the patient, because you will be changing gloves during through the procedure. So the first step when doing the procedure itself, in this case, is the first stages of pressure ulcer. You should ask the patient about date of birth and name, so you can check again the he or she identity. So what's your name?
My name is Victoria.
What is your date of birth?
2nd May.
Okay.
May 2nd.
So she said all the information we asked for. So now we may introduce ourselves and explain the procedure. So my name is Sofia. Today I will be your nurse. Today I will be performing a new wound change dressing. Okay, it shouldn't hurt. Did someone came in 30 minutes early and gave you the painkillers?
Yes.
Okay, so that shouldn't hurt at all. It will be a simple procedure. May I proceed?
Yes.
So she said that we may proceed. So the first step is that, of course, we did all the sanitizing procedures before. So first step in the procedure itself, we should remove the old dressing. We should unhold the bandages from the corners out from inside, not to hurt the patient's skin. If it's necessary, you may use a medical solution not to have contact with the skin or any rashes. So now you may remove the dressing. Now it's a very important part, because it's a wound, we should do the assessment of the wound, and you should check in the dressing if there's any liquid, any discharges, if there's any pus or any different excretion. So here we don't see anything different. We may close it and throw it in the trash. So second of all, now we will change our gloves. I won't do the procedure again because we already have video explaining it, but we should change to new clean gloves so we can assess the wound. So for assessing the wound, we firstly should clean it. So for cleaning, we should get the cleansing solution, put it in the cotton ball, and get the pair of medical tweezers and clean the wound gently from inner to outwards. So after cleaning the patient's wound, you should throw it on the trash. So after that, doing the cleansing part, you should assess the wound and check for a few signs of progression or change of color, of excretions, or if there's any pus, or if there's any abnormalities in the wound itself. If doesn't, you may proceed with the wound changing now. So again, you should change your gloves once again during the procedure for clean gloves. After that, we should get a pair, not a pair necessarily, but you should have new sterile gauze so you can put over the wound. Everything is fine?
Yes.
It's important to assure the patient and keep talking to her or he during the procedure. So after that, you will do the dressing change. For purpose of making the video quicker, I will just substitute for already cleaned one that I made before. So this one should be put into place. This should be the end result after putting everything in place. If you see that not secure enough or the patient asks for, you may gently roll a bandages over it.